Oh, we're frozen.
No.
Oh.
We're back. Hello, welcome to Revive 360. We are so excited for the new year, and with the new year comes weight loss.
Hey.
New year, new you. Get skinny, get on the exercise train. So obviously there is so much controversy and so many questions we get every day. We even see it on the news. It's everywhere. What are GLPs? And now there's so many of them. There's GLP-1s, there's 2s, there's 3s. So we're going to kind of break that down and talk about what a GLP is. So let's go ahead and get started. I hope you all are excited as we are to start this 360 for the new year. We have lots of new topics coming for this year, but let's go ahead and start with our GLPs. What does GLP stand for? Glucagon-like peptide. Again, we're kind of going back to those peptides. I know we talked a lot about peptides last year. And Price, you want to kind of explain what a peptide is? So just a refresher on a peptide.
Just nice and easy. It's a branch chain of amino acids for a specific amount. They're shaped like little keys, basically, that fit into specific receptors that already exist in our body. And then they help with certain metabolic effects, hormonal effects, things like that. But they're amazing. Magical little keys that plug in and help us do a little bit better with whatever we're trying to do.
So as we kind of go through and talk about these GLPs, this is strictly just education on the GLPs. We're not giving you full-on medical advice unless you call in with a specific question that maybe Mariah can answer, which you are can do that. If you're logged on, you can ask questions, and Dominique, who's behind the scenes, will go ahead and ask us those questions as they come in if you have them. Otherwise, it's just going to be kind of a brief overview. So really, kind of who are this episode for? People that are looking to maybe lose weight, people that have blood sugar issues, controlling their blood sugar. It can help improve nutrient absorption, can help reduce some gut inflammation, can help repair damage from dieting, stress, medication, hormonal shifts. I know you've had to do that with some people that are having hormonal issues. Sometimes these GLPs can help with that. Mariah can kind of talk about how there are different ways that these GLPs are being used for other body systems to help protect us in other ways. But let's kind of get started. GLPs. GLP-1, 2, and 3. A GLP-1 is really the most common. It's known as semaglutide. It's your Ozempic, Wegovy. Am I forgetting any of the other name brands?
I don't think so.
GLP-2 is going to be your trizipatide, also known as Mounjaro and Zepbound. And then GLP-3, which is just now hitting the market. And I am not even going to try to attempt the name because we all call it Retta, but I will let Price or...
Does it have a brand name now?
At least, no. Just
they haven't named it yet. I haven't
however
seen it.
you pronounce it, I'm not sure. We usually say retatrutide or retatrutide is usually what we hear.
I didn't think they attached like a Wegovy name or anything yet.
Yeah,
no.
That's going to be the generic name. It hasn't come out with its brand name. But what does a GLP-1 do? So that's a big question. So GLP-1, or glucagon-like peptide, it's going to tell your brain that you're full. It's going to slow down food digestion. It reduces cravings, helps control blood sugar, lowers insulin spikes. Your GLP-2 is going to support the lining of the intestines, improves nutrient absorption, helps heal the gut inflammation, supports overall digestion. GLP-3s, they're going to help regulate energy use, influence how fat is stored versus how it's burned, and they all work alongside each other. So really, once you get into like the GLP-2s and 3s, it's working along with the GLP-2 is going to work with a GLP-1, a GLP-3 is going to work with a GLP-1 and 2. So you just start stacking them, which gives you just better results. As far as the combination therapy is working better, Mariah, do you see a difference rather than, I mean, is there a rhyme or reason to putting people on a GLP-1 versus a 2, 3? I mean, or is it just really evaluating each person and what they're looking at, their body mass index?
It really depends on how you're looking at the patient and which route you're taking in the eyes of the FDA. Obviously, Wegovy versus Zepbound versus Mounjaro versus Ozempic, they all have different indications that have been technically FDA approved. In the compound pharmacy world, I guess it depends on who you're talking to. I take a more holistic approach to it and I look at the patient as a whole to decide what we're trying to achieve. But really, it just depends. I mean, I have my favorites that I reach for, but obviously, like cost plays a role, diagnoses play a role, the patient's story plays a role, what they're wanting to achieve plays a role. Really just depends. I mean, in the eyes of the FDA, there's pros and cons to semaglutide versus trizipatide, and then RETA, liver indications, there's cardiovascular indications, sleep apnea. There's just a lot more that goes into it besides just picking a name out of a hat.
So they kind of, what I was told is like another way to think of a GLP. It's kind of like a text message your gut sends to your brain.
Mm-hmm.
So I mean,
signal.
Yeah, it's a signal saying, "Hey, you don't have these. You're not having these cravings anymore. You're not craving the sugar. Or hey, you're full. Stop eating." And why, like, and I know we all have naturally GLP in our body because it's a peptide. We all have it. Maybe Price, could you explain like why do we need more GLP if my body already has GLP?
Yeah, and then there's also, hyper-inflammatory foods where we're ruining a lot of pathways in our bodies through the American diet anyways. And this is fixing a lot of those things that we've done years and years of damage on that we didn't know about really. I mean, that's one of my main things is that even with it helping with insulin output, that's usually so beneficial for really anyone who's on it just because of, again, processed carbs and sugars just killing that insulin response over time. But I think that's really where it's helping is it's helping improve mechanisms that weren't working properly in us for a long time, and that's what was leading to systemic weight gain and things like that.
So with the GLP-1, it's controlling, it helps with appetite control, but it's not like, I guess it's not the miracle drug that everybody thinks like, oh, I'm just going to take this shot, and now it's a pill form. They have sublingual drops. Like, I'm just going to take this, once a week, every day, depending on how it's being dosed. And I'm just not going to eat. And I'm just going to magically lose all this weight, right? Like, you still have to diet and eat right?
And
Yeah,
exercise.
completely exercise too.
Okay. So, I mean, I just feel like a lot of times everybody says, oh, well, I mean, even our president, he calls it, the fat drug.
The miracle worker.
Yeah. And you just take this and all of a sudden you wake up, a few weeks later and you're skinny. And that's really not it, right? Like, you still have to work at everything as you would any other kind of diet, right?
Definitely don't like the stigma behind them too, that it's like the cheater method.
No.
Because my personal opinion is that weight loss is weight loss. And if you're done in a healthy way, who cares if it's medication, the surgery, some oral pills, because in the long run, you're making yourself healthier and you're not going to die of heart disease or high cholesterol, right? Like, in the long run, you're making yourself healthy. So there's no judgment in how you do that. Like, I really just don't like that. Oh, you took Ozempic, like that's cheating. So your weight loss doesn't count. Like, I think we should just be celebrating the health and wellness aspect of it instead of tearing people down on how they lose weight. Like there's no reason to be
Well,
ashamed of it.
And I know a lot of people think, oh, I take this shot and it just melts my fat away. It's not melting your fat away. You're still eating a certain way, a certain diet. And I mean, you're not as hungry, so you're not feeling that deprived. Like I always tell everybody, like when I was overweight, I've lost 100 pounds myself. When I was overweight, I really didn't eat a lot. What I did was I didn't eat all day, then ate a huge dinner because I was starving, and then put myself in a food coma and went to bed and stored it all as fat. And then I go on a diet and I'd be like, okay, I'm going to go on a diet and I'm not going to eat all this. Well, as soon as I tell myself I was on a diet, I'd be like,
Crave it.
all I want is a soda. I want a cookie. I want cheesecake. I want like all of these things. And they weren't things I normally ate, really.
No, but food noise starts exploding on you.
Yes. So, I mean, the GLPs definitely, I mean, help with that part of the diet. I feel like it makes it easier to pick better choices, does
Right.
it not?
Oh yeah, it gives people actual ability to be accountable.
Well, and I think too, like it's nice because on the GLPs you can still have some of the foods that you used to enjoy, like as in not like a reward, but just like as I don't know, a treat or whatever. Like you can still have those things, but the GLPs also help you do it in moderation versus like you're on a diet without any GLPs. And yeah, like she said, you start craving the cakes and the sugars and the cheesecakes, and you go to like treat yourself after a week of, and I'm guilty of it too. Like you do really good all week, and then on Friday you're like, I'm gonna treat myself. And then you go and you're like, I'm just gonna have a slice of cheesecake. Well, then you lose self-control and you eat the whole cheesecake versus like the GLPs with adding that in, you can control yourself and just eat one slice or half a slice or one bite and you feel satisfied and then you move on and you're not constantly thinking about the cheesecake, the soda, the McDonald's. Like it's a good tool.
Yes, and then afterwards you can use that to at least be more accountable on being like
Mhm.
you liked how you felt when you were on that and weren't following that food noise and stuff, and at least hold yourself to a better standard with eating.
Right.
So, what about the people that are pre-diabetic or have some insulin resistance versus um, people that because I get the extremes of both. People will come in and be like, I'm pre-diabetic, I have insulin resistance, maybe I have, all the other diagnoses, the PCOS, all the things like that. Or we have the other extreme and they're like, well, I'm hypoglycemic. Can you kind of explain like how does the insulin resistance work with the GLPs? And then can people with hypoglycemia, maybe they're overweight, but they say that they're hypoglycemic and will have like these low sugar um, bouts. Can they be on a GLP? And how does the insulin resistance work? Like what is the GLP doing to help with that insulin resistance?
So it's basically, I mean, that's one of the things that they call a bad side effect also, but it's really that it's upping that insulin output if you are at a lowered amount. So obviously it's nothing crazy, but it will send out the proper amount for carbs and sugar in the bloodstream, which is something people aren't used to. And that obviously can lead to hypoglycemia. But while you're on this, because it is increasing insulin output, the thing is you don't have to go to sugar to increase your blood sugar to healthy amounts. I mean, you can take in a natural sugar source, something like an apple, banana, some you don't have to do candy or something like that. You don't have to do a bad source of sugar that's gonna make you raise your blood sugar a little bit.
And as it's breaking down your fat, it's also utilizing some of that too,
Yes,
right? Because it's
completely.
taking it back to glycolysis and reutilizing some of that as well, right?
And then I lost my train of thought a little bit. Um,
So for hypoglycemia,
yeah,
they can just, if they're on it and they're just feeling a little low, you would just
that's what I was
suggest
just
them
gonna say.
taking.
So, I mean, it has fiber with it too, which is a huge part of keeping your blood sugar nice and stable. So that would be my recommendation is just freshly ripe banana, apple, some sort of fresh food source that's going to also have fiber. So you get sugar, but you make it so it breaks down a little bit slower, and you get all the benefits of the fiber too.
So with the diabetics that maybe are on it and their A1C is, let's say 8, it's really high. Are they going to see the weight loss? Like maybe somebody like me that's not diabetic that goes on it first, or is it going to correct some of their diabetes issues first?
It'll definitely correct the A1C first before weight loss happens. I mean, you may still have some weight loss at the same time, but first and foremost, it's going to correct that insulin sensitivity and the high A1C, and then weight loss comes secondary.
Okay. So do people, maybe your diabetics that are on, let's say like metformin, glyphosate, do they still usually take all of those with your GLPs? I mean, is that something like you just add on as a whole nother med, or can you wean them off of some of those others?
That definitely becomes patient specific
Okay.
and provider specific. I know what I like to do, but
It's
not
really based
everybody's the
on-
same, and it's really based off of like how people respond to the GLPs, where their blood sugars are at, where the A1C's at, what medications. I mean, that's kind of a loaded question. There's a lot that goes into deciding what meds they stay on, add, take off.
So that I guess my point to that is it's important that, I mean, at least here you're filling out a very extensive intake that you're going over and really looking at that. So you do see, again, like the whole picture of the patient, because we know that you can get GLPs just about anywhere. I mean, I see a commercial every day, Hims and Hers and
Yes.
Yeah,
all these places that you can just log on yourself and they'll send it right to you. But without really, I mean, if these are loaded questions and there's a lot to it, I mean, maybe
Yes, those
it's
people
better
aren't looking
to.
at history and background and what else you're taking or anything.
well,
like
there's a
that.
lot of like studies and education that goes behind these too, and if you don't have that background and you don't know what you're dealing with and what you're up against, like it can truly become a little bit of a risky behavior and not managing things properly. I mean, I've done extensive research into these and read endless studies, like more than I
Right.
probably care to, but yeah,
Well,
there's just a lot.
for the audience, you are completing your doctorate. You're just getting ready to finish your doctorate on GLPs. So you are almost
that
the
says
Valley
something.
expert, the Gila Valley expert on GLPs probably in this area. So, I mean, that's huge.
Which is why it becomes a loaded question, and there's a lot more that goes into it versus just picking one or the other, or like adjusting medication, coming off of meds, staying on meds. Like, what do you do? There's a lot that, because every med does something different and it's working on different systems in the body, and maybe some are managing blood sugar, some are keeping the blood sugar from dropping too low. So you really got to kind of play with them and really fine tune per person, per story.
So, as far as like, obviously, we talked about like the brand names, Ozempic, Manjaro, Zepbound, whatever they decide to call Retta here in the future. Is there really a big difference? I mean, am I going to lose the same amount of weight if I take semaglutide from a compounded pharmacy or I take Ozempic? Like, does one work better than another? Just because, I mean,
Just because they say it's for something else.
I wouldn't necessarily say one works better than the other, but it also does depend because the compound pharmacies are able to make it more patient specific, and you can adjust the doses per patient specific. So it really becomes more personalized versus like broad spectrum. But then also like they add in different ingredients for, like, let's say muscle wasting, fatigue, B12. Like there's a lot. The compound pharmacy is a lot more specific in what you're trying to achieve, and you can alter the doses a little bit versus like big pharma. It comes in one dose and it's a pen, and you take the same dose every week for 4 weeks, and then maybe you adjust it. And there's not as much wiggle room and leeway like there is in that.
like I know you did that for me. So when I was on trizipatide, I was taking that 2.5, but oh my gosh, like it like I didn't want to eat anything. Like I felt like it was just way too much. So then you had actually micro dosed me and did the 1.25, which worked amazing, but you couldn't get that in a pen, correct? Like that.
No.
So that would be a good reason or indication that compounding pharmacy
Or if
actually.
like the preloaded syringes make you nauseous or you're super tired, you're losing muscle, like the compound pharmacy, that would be nice because you could add in lysine, glycine, B12 for all those reasons, and then really specify the dose to kind of achieve optimization.
Okay. Well, that makes sense. Um, with the GLPs and when you're taking them, there is that muscle wasting that people always call it Ozempic face, Ozempic butt. Um, it, can you maybe just talk about like, is there like things you can do to counteract that? I mean, you don't necessarily have to give like the long list, but I mean that doesn't have to happen, correct?
No, and there's
It's not
plenty of
supposed to
people.
happen,
No,
actually.
that's from giving improper guidance from people just obviously starving themselves in ways too. That's what that is coming from, is people not eating proper, they're being too restrictive on their diet, and they're losing vitamins and minerals that are essential to your body, and also not enough calories. I mean, we have to survive off of something.
Protein.
Yes, exactly.
So I know, Mariah, like I've heard you with some other clients here in the past, and I know you've said like we'll be going over clients and you'll notice that maybe they've had some cardiac issues or some renal issues in the past, and you know sometimes I'll pre-look over the client's intake and I'll be like, oh, I'm not sure if they're going to be able to do this because they've had a heart attack in the past, and I've heard you say sometimes like no, like they should be on it for those reasons. Is that correct?
Yeah, the FDA and the FDA.
Well, I guess not everybody.
Yeah,
right?
I mean, well, and it's medication specific. Some are good for one thing, some are good for the others. Really depends on who you're talking to, what you're using it for, which realm you're using it. Is FDA, compound, insurance, like that all plays a role. But generalizing it, yes, they've been studies have shown that they're effective in for cardiovascular disease, kidney disease, sleep apnea, people who have had heart attacks and strokes, chronic kidney disease. Like they're proving effective in not necessarily reversing all of these things, but stopping the damage from furthering. So it's not gonna like perk your kidneys back up so they're working again, but it's gonna stop the damage and prevent it from progressing as aggressively per se. And then I mean the cardiovascular, you're losing weight. Weight loss leads to usually lower lipid panels, so your lipids are improving, so that decreases your risk for stroke. It decreases the risk of heart attack. You're protecting your heart, all of that.
I do see a lot of patients that one that came in today that's lost over 100 pounds, like their blood pressures.
Mm-hmm.
So we had a patient yesterday come in for an IV because they have lost over 100 pounds, but didn't realize they should stop taking their blood pressure medication. So took their blood pressure medication and ended up in the ER because their blood pressure had went over, dropped to like 80 over 40, went into the ER and had to, get some hydration and do some things, and then had to follow up here just to kind of continue with some of that hydration, and was told. But that was something like nobody told them. Like they were on this weight loss journey, but nobody said, "Oh, you might need at some point to stop taking blood pressure."
I do see that a lot. Like patients who maybe start this journey unhealthy and they're on multiple medications for various things. Like I've seen where they go on a GLP and they lose the weight and their blood pressures improve, their cholesterol improves, and some of those meds, like patient specific, can be adjusted, lowered, titrated off. Like, yeah, I mean, I've seen that too. And
so another reason, I mean, maybe not such a good reason to maybe just bounce to these online platforms, because who's monitoring that? Yeah, I mean, that would be kind of be scary if you're on multiple meds and now you start losing that weight and living a healthier lifestyle. Yeah, maybe you do need that follow-up with the PCP to make sure that those are getting lowered or removed.
And then, like, as redundant as people think visits get with PCPs and stuff, like I like to do check-ins every couple of months to really just see where patients are at, and look at medications and numbers and labs, and kind of really make sure everything's still matching and they're not having adverse effects, because maybe their blood pressure is dropping too low, or the blood sugar is getting low, or they're on too many medications for blood sugar. Like you can really adjust everything as needed and as the numbers change.
So I know we're getting close with about 5 minutes left on time. And Dominique, do you have any questions from some of the audience that maybe we could answer before we close up?
Yes. Somebody asked, I know you guys touched on it, but will you lose muscle on GLPs?
Not if it's done correctly. That's where the high protein diet comes in to play. And we discuss a lot. We go very in depth here over that when people do start certain medications and treatment plans. Like we have a very in-depth, extensive education that is required. And we do touch on that because, again, the news and media, Ozempic butt, Ozempic face, like it's crazy, but social media. But yeah, it all comes down to diet.
And I know here at Revive, when you come in, because we'll get a lot of even healthcare providers that want to come in, and of course they know about these, but because you are so strict on what patients get, we do sit down with every patient and go over how to do the injections, what they are, how to do them, and then all of our patients always meet with our nutritionist Price as well, just to make sure they're getting the nutritional aspect and really how to follow a proper diet. And then we do a body analysis scan. So Price and patients and you can all see really what their skeletal
Everything.
muscle, yeah.
You can see between bone mass, skeletal muscle mass, fat mass,
Water.
everything. Yeah, the water in your body. We can see what's extracellular and what's intracellular. We can see all different biomarkers for health, which is awesome.
And those are free for our weight loss clients once a month to come in. And then you can always sit down with them each month and go over those results and really like fine tune what they're eating, because I know our diet starts off usually with our clients a very certain way at the beginning, but as they go on this journey, I mean, you adjust them quite often, right? And start saying, oh, well, you can maybe add in this now.
Oh, completely.
Wait, next month, and you can add that in later, right?
Yeah, people all the time at least be questioning on what they can do, because we start off giving them a completely foreign diet to what they're used to, and then obviously everyone's different. Everyone handles food a little differently on this. So and it changes the whole time, depending on if you feel like you're getting deficient in something, or you feel like your hair's falling out a little bit, something like that. I mean,
and those scans can really like give you almost an inside look into their body to help them adjust all that, right?
Oh yeah, even inflammatory markers and stuff like that. It is awesome.
So just for clients that are coming here, just so you know, like that is free for those clients. For clients that are not on GLPs, we still can offer that service as well. It just comes at a small cost, correct?
Yeah, it's $10 for the scan.
Any other questions, Dominique?
Yeah, somebody asked, they've done a bunch of different diets before. They've had some results with different diets they've tried, but overall really didn't have any good success. Whereas on the GLP, they were able to actually lose that weight.
That they were?
Why?
They were. They want to know why.
Okay.
Why wasn't the traditional dieting working?
One of the hardest things with an actual diet is every pound you lose, normally, your body craves 100 calories. Your mind tells your body to eat 100 extra calories per day until you fill in that gap of whatever weight you've lost. And it keeps that up for, on average, about 14 months. So usually when you do a restrictive diet, you also go through lipogenesis, where you're doubling your fat cells, because your body thinks you're starving. So it goes into a state where it thinks that it needs to make more fat cells, so that the next time you start eating food, you can store more faster. And it comes back faster. That's why everyone always wonders how, I did this 1,200 calorie a day diet. The second I got off it a few weeks later, I gained all of the weight back, or a few months. It just crept up slowly. And that's because your brain is craving those extra calories, which the peptides, actually one of their mechanisms is stopping that function. And they also, for the most part, prevent lipogenesis, because your brain doesn't go into that starvation mode.
So is that why a lot of times with our weight loss clients, the ones that come in and say, oh, I just want to lose 10 pounds, and maybe they do in that they'll go on it for a month, they do lose their 10 pounds, but then we see them 6 months later.
Yes.
Is because that kind of same scenario versus like the clients that, maybe have been on trizepatide for a year and have lost 100 pounds, they go off of it and they continue to be successful.
It's exactly, it's that time period.
Okay.
If you can make it past that 12 to 14 months, then usually all of that goes away. Your body accepts your new weight that you're at.
Okay.
But that's one of the best things about these, in my opinion, is people don't have to deal with that horror. That's a side effect for every human in the world. There's not one person that doesn't experience that exact thing. And that's why people always slowly bounce back to that weight, besides through this method for the most part. I mean, unless you're really good at keeping a specific healthy diet for a super long period of time, you don't let yourself have sweets or things like that. But that's the nice part, like you were saying earlier, Mariah, is that with this, you can give yourself the control that you can really have something little, you can have a little snack or something, but you're not going to want the whole cake. And otherwise, your brain's trying to have you to eat that whole cake because it wants you to get that weight back.
So you can make the cake and have a slice too.
Yes, exactly.
Of the whole thing. All right.
Any other questions as we get ready to close up?
There was a couple more, but I feel as though you guys answered them. Is there I think my biggest takeaway from today was that a GLP can help with so much more than just weight loss, and that's really interesting because like Mariah said, I do see on like TikTok a lot, oh, Ozempic got them, another celebrity got Ozempic face, but that does not have to be the case either after learning from you guys today. So,
and I think if you have questions, you should always just swing by and ask us. We're pretty open here.
Yes, absolutely.
And we don't necessarily, you can make appointments online. You can go to azrevive.com and you can book a weight loss appointment. When you hit that book appointment now, it will send you our pretty extensive intake form. And we know it's a lot, but it really helps Mariah get that 360 view so she can overlook it. If she has any questions, she usually reaches out to our clients or will ask me as the nurse to reach out and maybe just clarify something. Once we know people are approved, we can go ahead and set up that appointment where we can sit down and talk, but we always welcome walk-ins. You can always walk in and talk with at least a nurse and kind of get some more information on the medication. You can fill out the paperwork here in clinic and see when sometimes Mariah could get to it really fast. Sometimes it does take a little while, just depending on her client load for the day. But we are always here to answer questions. Same with nutritional questions. Prices here Monday, Tuesday, Thursday, Friday. Wednesdays typically he's not here. But we can always get him messages and he can reach out to you later in the evening if needed. As far as what is our topic next week, Dominique? Do you know off the top of your head? Otherwise, we will probably get ready to close out.
Remember to like and subscribe.
Like and subscribe, ring the bell.
That bell.
You can also visit us on Facebook for Revive. Dominique likes to post most of all of our specials. I know we are doing this month is we are giving $50 off of our first month's semaglutide for new clients. So I guess any clients, even our returning ones for month
anyone
one.
Restarting.
$50 off on that. And then any new specials that's going on, she always likes to post those on Facebook. So definitely like us on Facebook, subscribe to YouTube, visit our website. You can book appointments. We should be having Priscilla is now graduated and ready to run. So
almost ready.
Yeah.
Almost ready. Getting her room ready today. She was back there putting all supplies away. So you're going to start seeing a lot more services hit the online to be able to book for her services as well. It is also the season for getting ready for the summer. So laser hair removal. we're starting to see a big uptake on clients wanting that. So that way they are hairless by the time bikini ready by summer. So if you are thinking about that, now is a good time to jump on that bandwagon because if you want the nice bikini, no, don't have to worry about shaving or the razor bumps. It's a good time to start the laser hair removal so that way you are bikini ready. Our next talk is going to be on exercising. Or so, oh, well, you will be talking about exercising. And then the one after that will be on sexual health. So next week, we'll really
Bunch of fun stuff.
talk about exercising and how we can, as we do new year, new you, and you're on your GLPs, we'll talk about how important exercising is. My least favorite thing to do. But I need to get doing it. All right. So anyways, thank you all for subscribing and listening to us. Again, if you have any questions, please come by, call, text, email. If you have any questions on exercising or anything you would like to answer next week, you can always send them to admin@azrevive.com. And Dominique will make sure we get those answered on our next Revive 360. Thank you all. See you next time.